All right, welcome everyone. As I said, so excited to be here for you with another year, another wild year of us understanding what's happening in the Medicare space. So let me see what I can do to mute people as I go through. Sorry about that. Um, so we're just going to get started here. Want to do a little quick recap of what some of you remember from my emails back in July and August, and what happened at that point versus where we're at today. So first thing I would say is that, in about July, I don't remember the exact time frame, Scripps notified Alignment that they were no longer going to be in network with the Scripps plan or Scripps doctors at Scripps Coastal or Scripps Clinic. So, as you might remember, a year ago, or a little over a year ago, we had the situation where Scripps had decided to terminate all HMO plans that were available and then put most of all the other PPOs that were now coming into the market um, as out of network. So alignment became really the number one choice for anybody to then have the lowest cost to get to Scripps hospitals, even lower, right, than even the HMO plans from the previous couple of years. And so the alignment plan was the best, the lowest expensive, lowest cost, and the lowest risk in terms of the maximum out of pocket. And hopefully, all of you who are on this call today have been experiencing that, right, throughout the year. I know there have been a couple of hiccups here and there, and then, we talk to alignment and they usually fix it within a couple of days and it's all taken care of. But it's still been the only PPO plan that was in network in 2024. So, a little bit of the good news is, well, we did okay for 1 year, right? I was hoping and doing, as many of you were at some of my meetings there in Carlsbad at the library last year. We had Alignment supporting me. Alignment's vice president was there, right? And they were there to support and say, hey, listen, this is what we want. We want to have a long-term relationship with Scripps. And the fact is the plan that they developed, the actual plan that you're on, was developed specifically for Scripps Coastal and Scripps Clinic. So it wasn't designed for all the other doctors that might have joined it since then, but it was designed for Scripps. So when Scripps decided to terminate it, not terminate the plan. Remember, that was the whole issue. Wait, I've been terminated, and Alignment's terminating it. We were like, no, 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 no. Alignment isn't terminating the plan. Scripps is just making Alignment be out of network. So it's kind of like they were the exception. Now you got to play by the same rules that every other PPO plan in San Diego has. And so that's what we were told. So what happened since then? Well, Alignment, after receiving that letter, went back and with their internal decisions, they have to submit their plan changes every year to CMS, right? The Medicare system. And Medicare kind of reviews everybody's plan changes anyway on an annual basis. So you have to submit your plan to CMS. Well, they decided at that moment in time that they said, well, this plan that we designed completely for Scripps is no longer working with Scripps, right? It's just out of network. It's just going to be a PPO plan. So they had to evaluate some of the costs and the different things that were in there. And ultimately, they came to this decision that they decided to terminate the plan. So two things happened. Scripps terminated Alignment's ability to be a network. That was number one. And as a result of that, after a few months of deciding what to do, they went ahead and decided to terminate the PPO, the 007. Now it's not the James Bond of all PPOs. So we got to find out what's next, right? Um, and if you think that like people like myself or any other insurance agent has inside knowledge on these things, we don't. Medicare has all of these very, very strict rules that basically states that we will only learn on October the 1st. So October the 1st is when the plan changes were completely made, and Alignment chose to send out their letter at the very end of September, which maybe some of you got. I've heard that I was the first one to tell some of you that, the plan was being terminated. You didn't know it. And so I'm sorry about that, but you should have received a letter from Alignment as well. So that's kind of the history as to where we are now, right? So that's where we got to. So the first thing I want to bring to your attention is that after those months of alignment, deciding what they were going to do, there's another really good benefit that they did for us. And what that was is that by terminating the plan, they gave every single person who's currently enrolled in the PPO plan the ability to go to any Medicare supplement with any other insurance company with no medical questions. So I know, sadly, that some of my clients this year have been diagnosed with some form of cancer. And in a normal year, in just a typical situation, those clients would not have been able to go to any Medicare supplement because they would have to then answer the medical questions. And one of those questions is what? Have you had internal cancer? And you would be immediately declined, and no other Medicare supplement would accept you. So, this is actually a good thing because it gives you one more choice, and it's a guaranteed choice. Now, that doesn't mean necessarily that you have to choose it. It doesn't mean necessarily that you want to choose it, but it is an option now for every single person to be able to switch to a Medicare supplement plan and not be able to be turned down. So that is a really good thing. Um, and then what's the second best option? Well, as I've kind of said in some of the previous emails, the second best option is that you could still choose to go to Scripps and see the doctors that are there, but you're going to be seeing them as out of network. So what does that mean? Well, we'll take a look at a couple of summary benefits tonight, but when you look at them, an in-network is like one column that says, I'm going to pay less money when I see my primary, when I see my specialist, right? When I have services like labs and MRIs and x-rays and things like that, right? In a PPO plan, there's always two columns. The left column typically is your in-network or less expensive cost. And on the right column is what is called the out-of-network cost. And that means that you choosing to go to see doctors that are outside of the contracted network that they have. So just to reiterate this year in 2024, there are three other companies that are still working with Scripps, and they've been working with them all year, but all of their plans were out of network, right? So if you want to take any kind of notes on this, I'm going to tell you the names of the companies because these same companies are going to roll into 2025. All right. So Aetna Core PPO is one of them. You don't have to remember the plan names, but Aetna's PPO, Blue Shield PPO, United Healthcare PPO, and then Alignment. So all of those first three I mentioned outside of Alignment have been able to go. Alignment has been a great company, but a lot of people, when they got kicked out of Scripps, they were kind of like unsure of what to do. And so there were a lot of people who went to the bigger brand name, right? A lot of people know who United Healthcare is. The reason I didn't, encourage everyone on this call to go to United Healthcare is because their costs were all higher, right? Every single one of those plans for you this year, all of those costs were higher and the risk was higher. And so that's why I didn't encourage it. But guess what? As a broker, I represent Aetna, United Healthcare, Humana, Blue Shield, right? I represent all of them, but I wanted to put it in front of you what I thought was the best interest for you, right? And like I said, hopefully that has worked out for you this year. So, what does that mean for next year? So, Alignment also is coming to the market with two new PPOs as well. But with those two new PPOs, you can probably answer this question internally, is they will also be out of network, right? So that means that you now have a total of 6 plan choices with 4 companies that you could still get to Scripps Coastal, Scripps Clinic, but you'll just pay higher costs. All right. So number 1 is the most expensive option. Number 2 has the most risk financially for you, and we'll break that down in a second. Because again, the maximum out of pocket is where you have to worry about, and let's just say the current plan with Alignment, right? It was $8,950 was your worst case risk this year out of network. But because you were in network, it was 3,900, right? So that's what you were facing. Now, all of the plans are roughly in that same ballpark of starting at about 8,900. All right. And then there is a third option. And I know, especially for all of you who are on this call, the third option may not be something you want to consider, but I'm going to let you know what the third option is. It's called finding different doctors outside of scripts, right? I mean, a lot of people had to make that choice a year ago. If you think about it, there was 32,000 people who had been kicked out of scripts. I know that might not be the technical term, but it's really what happened, right? 32,000 people had to make a choice. Well, about 10,000 of those people last year went to UCSD. And so, if you think about it from a reputation standpoint, UCSD has a very high reputation in terms of just doctors and their hospitals as well. And so a lot of people made that choice last year to leave scripts. Other people went to Sharp. Other people, went to a variety of a couple of the other medical plans, medical groups in town as well. Sorry. Going to take a sip of my Adele endorsed tea right here, real quick. I think it's one of those things too. The more I talk, the more I cough. So I apologize. So there are different plans, right? There are still HMO plans that are available. There are other PPO plans available. Humana has an excellent PPO plan that it works really well with the UCSD medical group, but again, outside of scripts. So if you're a person on this call and you're saying, you know what, I still love scripts. I love my doctors. I love my specialists, and I want to be seen at the scripts hospitals. I get it. So we're going to focus about those two solutions. And if you want to talk about, going to another HMO type of a plan or another medical group, then I would suggest that you come to one of my in-person meetings next week. In the evenings, we'll be talking about United Healthcare. We'll be talking about SCAN. And then we'll be doing an alignment meeting that's more like this, right? But we'll be talking about alignment as well. And alignment does have a couple of great HMOs as well, just not with scripts. Okay. So I want to do a quick little recap. Um, on what those options are. So when you probably, I'm going to share my screen here in just a second. I got to pull it up. Sorry about that. Give me 2 seconds to pull this up. I'm doing really good or all of you are still in sticker shock and nobody's asking any questions in the chat, right? Who's going to be the first brave one to throw a message in the chat? We'll see. All right, I'm going to share a screen. This is really it's by United Healthcare, but it's something that is available. It's just a good educational piece. Okay. All right. So it's going to move the picture of me and all of you around just a little bit. But go ahead and give me a wave if you can see the screen. All right, perfect. So this is by United Healthcare, but again, it's just what they call a clarity guide, helping people understand how the Medicare system works. All right. And again, this is kind of a refresher just for most of you, and many of you might know it, but I just think it's important to go back and share it again with everyone just to make sure that we're really, really clear. All right. So when you started, right, in Medicare, you had to enroll into Original Medicare. And we all were given this little Medicare card, and it had a letter A and it had a letter B on it, right? Whoops, sorry about the handwriting. So you had your Medicare A and B card, and you say, okay, well, what does that cover again? Well, again, Part A stands for hospital or inpatient. Part B stands for outpatient services. And the general rule of thumb that we would say to everybody is that Medicare covers 80%. Now, there are some deductibles and things like that, but as a general rule, we like to say that Medicare covers 80% of your needs, which then leaves us with what? Well, what people would say is a gap, right? So we have a gap of 20%. So you then had a choice, right? Everyone had a choice to decide, well, do I want to go with option number one we'll talk about or option number two? But the other thing I want to mention is that depending upon your income, the base Medicare rate for everybody should be 174.70, And, if you're blessed enough to have a higher income, your cost might be a little bit higher for Medicare. But in general, most people are at the 174.70 on a monthly basis. That's our price of entry, right? So everybody should be paying at a minimum 174.70, and that gives us the 80%. Okay. You're like, Paul, why are you doing this? I did your Medicare workshop 4 years ago. I don't need to see this again. I get it. I'm not going to preach for 2 hours. Okay. I'm just giving us a quick little recap. Okay. So then you say, okay, well then what was next? Well, when people ask me what my job is, I don't say I am an insurance agent. I don't say I sell Medicare. What I say is I protect my clients from the 20% of unknown costs that are available, that are possible regarding their healthcare, because that's truly what I do. And so what we do is we talk about the two options that are available to you, right? Option one and option two. So when I talked about the situation with scripts and saying, okay, we have, um, sorry, I'm still not the best here at these things, but I'm trying. We have two options. And so what we're saying is we want to talk about the Medicare supplement as the first option for you. Okay. So this is the most comprehensive option that you can have, but it's also the most expensive. So option one is either called a Medicare supplement or it's called a Medi Gap, right? And why is it called that? Because it fills the gap, right? So it fills the 20%. Now, depending upon your age, when you were born, the most popular plans were Plan F and then now Plan G. Anybody who was born in 1955 or later, the Plan G is the most comprehensive plan. If you were born in 1954 or earlier, then you might still get a Plan F. Regardless, Plan F or Plan G, they're the most comprehensive Medicare plans that are available to you. And that's what you get guaranteed acceptance into. Okay. Because of the termination of the PPO plan, you are guaranteed to not be turned down. Now, if this Medigap plan, and somebody said last night, well, who offers these Medigap plans? Well, it's pretty much all the major top insurance companies. So companies like United Healthcare, Blue Shield, Physicians Mutual, Humana, Anthem Blue Cross, right? All of the major companies, most of the major companies offer a Medigap plan. And it doesn't matter which company you go to regarding the benefits, because what I like to say is a plan G is a plan G is a plan G. The benefits are federally mandated that they have to cover the 20%. So every single company has to cover that 20%. Now, a couple of them can do a couple of neat things by adding in, like, the free gym membership, right? So a couple of them might have a couple little extras, but medically speaking, they're federally mandated to be the same. Okay. What is different is the monthly cost, right? So Blue Shield's cost might be slightly higher than United Healthcare, or Humana might be better than both of them. And a lot of that depends upon your age and your county or the zip code you're living in, depending on the company. Most rates are all the same throughout San Diego, but a couple companies have it like by zip code. So, question that you might be asking, well, what's a Medigap going to cost me? Well, I'm not going to make everybody say what your age is or your date of birth on this call tonight. So I'm just picking a number of age 70. Okay. So let's just say that you were age 70. The average Medigap plan is right about $200 a month. Okay. So give or take, and depending upon your age, it could be a little bit less, it could be a little bit more. There are also some household discounts. So if you live with a spouse or you have a roommate or you haven't been able to kick out your kid and you live with somebody that's 18 years old, excuse me. I know I'm laughing at my own joke, right? Coughing my way through it. But if you had somebody living with you that's 18 years old, one company will allow you to get a discount. All right. So again, there's a couple little things. And if we go this direction, if you choose to go this direction, we'll talk about your specific rates in a one-on-one appointment. Okay. So that's the cost, right? So just to double check, is this in addition to the 174.70 that you're paying on a monthly basis? Any ideas? Yep, I see Adele shaking her head, right? It is, because remember, I know it's hidden up here and I want to keep the screen as big as I can. Medicare at the 174.70 pays for the 80%, and this $200 is paying for the 20%. Okay, so if I have 80% from Medicare, 20% from the Medicare plan, any mathematicians out there? Yeah. 100% coverage, right? That's why it's the most comprehensive plan, because now you have 100% coverage. The other thing that you get with this type of plan is you get full access to any doctor in the entire nation that is contracted with Medicare. So it's not about Scripps or Sharp or UCSD or Cedar-Sinai, right? It's about any doctor anywhere in the country that takes original Medicare. And about 95% of the doctors out there take original Medicare. There's about 5% that I would say fall into that range of the concierge or boutique type of doctors who may not take Medicare, but the majority of them do. Okay. All right. So that's the first thing that I wanted you to know. The second thing is with original Medicare, in almost every case, you don't have a referral either. So just like in a PPO plan, where you might want to go directly to your dermatologist or your orthopedic, whatever, you don't have to get permission from your primary to refer you. So the largest network in the US, no referrals, and guess who takes original Medicare? Scripps, right? So last year and this year, the most guaranteed way to get to Scripps Coastal and Scripps Clinic is to go with original Medicare. And it also is the strongest way to protect your risk. Okay. But it's higher on a monthly basis. So when we're going to make our comparison tonight, I'm not going to include the 174.70 because that 174.70 is again your entrance price. It's the same no matter which option you choose as your step two. So really what we're going to be comparing is this $200 a month, okay, versus whatever the cost of a Medicare Advantage plan is. If we said what it is this year in the alignment PPO, well, that's zero, right? Because on a month-to-month basis, you're not paying a premium for the plan. So on an annual basis, right, this is 2,400. And then with Plan G, which is, the most popular plan again, there is a one-time deductible per year of $240. Okay. So that's a one-time deductible on Part B for that. So if you had to write it down, you're looking at what? $2,640 if you were a 70-year-old, give or take, and you're going to pay that pretty much every single month or every year, right? Whether you really go to a doctor, you're going to pay a minimum of $2,400. If you see a couple of doctors throughout the year, right, you'll meet your deductible and your cost will be $2,640. But once you're paying that monthly premium, you have 100% coverage. No copays, no coinsurance. You can go to MD Anderson, you can go to Moore's Cancer Center, UCSD, Cedar-Sinai, right? You can go anywhere. All right. So you have the most freedom in this type of a plan, but it's the most expensive. Now, because we're basically separating out the parts of Medicare, right? We now have what is called original Medicare. That was your original Medicare card. We've added the Medigap. So we get another insurance company that gives us this Medigap plan at a price, of course. And then what about drugs? Okay, I'm going to take a sip here. Sorry. I'm doing everything to kick this before I come, right? And do the presentations next week. My wife's got me drinking some kind of, we like to call it a witchy brew, She's got all kinds of natural remedies in this thing, and then she shakes it up in a bottle and it like sits in the closet in the dark for like 60 days, like doing whatever it does, right? And then I take a shot of it every single day and it just burns like crazy, but she swears by it. So we'll see what happens. All right, so prescription drugs, right? So Medicare prescription drug plan. In your current plan with alignment, your drugs are packaged together, right? You have a one card solution we'll talk about in a second. But if you take this path, well, then you need to get a Part D drug plan, even if you don't take any medications, okay? So if you're on no medications at all, well, you still need to do it because otherwise Medicare has a penalty if you don't have a Part D drug plan. And as we get older, many of us are taking drugs and we want to get that discount at the pharmacy anyway. So what is the cost of a drug plan? This year, my most popular, most famous plan was 40 cents a month. Okay. 40 cents. All right. Well, that's not bad. Right. And then you pay for whatever the copays at the pharmacy are. And they weren't extraordinary, just like your plan now. Most tier ones and tier twos are like between $0 and $5. Next year, that 40-cent plan is going up. And so it's $17.40. But there is a low plan for next year with Cigna that's $1.80 a month. So if you're a person who's on mostly generics, you didn't take any medications, right? Maybe the $1.80 plan would work. Maybe another one of the plans that ranges anywhere from 17, but they can go all the way up to $188 a month, which is insane. But maybe you have a specific medication that only that company covers. And so it might be worth it to you. All right. So there's three costs, right? Our original Medicare cost, then we have our Medigap cost, and we have a prescription drug cost. So I'm going to say it one more time. It's the most expensive way to get to scripts, but it is the most comprehensive way to get to scripts. And it also protects your financial pocket because your worst case scenario is what you pay, right? It's what you pay. So on a monthly basis, you're paying that $200 a month plus the deductible. Okay. So it's a hard number, right? And sometimes it's a hard number to swallow. You're like, I don't know that I want to do that. Totally understand, right? And that's why I'm giving you these options. And if you feel at any moment in time that I am leaning you or steering you towards one side or another, please understand I'm just trying to emphasize the points because I'm not. In my personal clientele, about 50% of my clients are on a Medigap plan, and about 50% of my clients are on a Medicare Advantage plan, whether that's an HMO or PPO. So I, it, I don't want to say this, but it doesn't matter to me what plan you choose, right? It's really up to you. If 50-50, that basically means that neither plan is bad or neither plan is extraordinary because it's really what's best for you, right? It's not what's the best plan, it's what's best for you in your situation. Okay. There was a couple questions. Dan, great to see you on here tonight. If we decide an alternative plan, what's the mechanism for changing? Obviously, I am your agent. I would love to continue to be your agent, so I'll help you compare these plans. And when you make a decision, yes, I would love to help you enroll you into whatever your next plan choice would be. Adele, you said, are they all out of network? If you're asking the question about, again, all of those PPO plans, on the right-hand side that we're about to go through, yes, every single PPO plan in San Diego County is out of network with Scripps. So again, the most secure or the most guaranteed way to get to Scripps is through original Medicare, and you're protecting your pocketbook by getting the Medigap plan so you don't have, right, 20% to an unlimited number. One more question that I think people have heard or talked about is, well, what's the maximum out of pocket on a Medigap plan? Well, technically that doesn't exist. It's not about a maximum out of pocket. It's about unlimited protection. Because if you had a medical bill of $100,000, Medicare pays 80,000 and the Medigap plan is going to pay 20,000 on your behalf. So there's no max out of pocket. It's basically flipped around. It's unlimited protection. And what you risk is what you pay on a monthly basis. All right. This is again kind of crazy. A lot of red letters over here, right? All right. So what's option number two, right? Well, option number two is exactly what you're in now. And what we'll look at some plans that are available for next year, right? It's basically a PPO plan is the next best option to get to Scripps. But as I said, you're going to be out of network. But just as a quick reminder, what is a Medicare Advantage plan? It's a combination plan of Part A, Part B, and it says most times or usually Part D. In almost every plan, the Part D is included. And so we've got our A plus B plus D equals C, right? Part C is the Medicare, technical term for Medicare Advantage. And I don't know that it's ever been in writing this way, but I like to say Part C stands for combination, right? You've combined your hospital, your outpatient doctors, and your drugs into a one card solution. and that's what you've been on. So, well, what's the benefit of these plans? Well, a lot of them have been what? $0 on a monthly basis. And you still have that option for next year. So we'll look at that. But here's what I like to say. This is a pay as you go plan, right? Just like you have now. You're going to have a copay when you go to a doctor, when you go to a specialist, when you have an MRI, if you have an x-ray, if you have physical therapy, right? As you go down with whatever your services are throughout the year, there's going to be a copay for those services. If you don't go very often, if you have minimal visits to doctors throughout the year, you might end up with only a couple $100 of costs for the whole year. That's great, right? And hopefully for most of you on this call, that's how it's been working this year. So what is the biggest risk? I've said it a couple of times, right? The biggest risk is what we call the MOOP, okay? And the MOOP stands for the maximum out of pocket, right? So the maximum out of pocket. And in most of the plans, as I've said, because Scripps is out of network, we're going to be looking at about 8,950 all the way up to about $12,000, depending upon the plan. So why am I showing you this number? It's not to scare you, it's reality, right? It's in your existing plan right now. So if you think this is expensive, you're paying on the Medigap plan about $2,640 for the year. But that's it. You'll never have a higher rate. And obviously you're paying it monthly based upon your age. Over here on the PPO plan, you might be paying zero, might be paying a small premium, but you have a risk of anywhere between 8,950 and up to 12,000, depending upon the company you choose. So the risk is if I asked any one of you, if you knew you were going to have a medical situation where you were going to end up paying $100,000, and so your maximum out of pocket was going to be hit, would you rather pay 2,600 versus 9,000? Of course, right? Of course we would. The challenge is we just don't have that crystal ball, right? We don't know what our situation is going to look like next year. So those are the two options, right? If you want to go to Scripps, these are your two options. So now let's go ahead, and if there's any chat messages before I switch, I'm going to start showing you some of the plan options that are available um, for next year. But if you want us to throw anything in the chat, please go ahead and throw something in the chat up there. I'm going to go ahead and close this. Whoa, check that out. That just kept everybody up there, huh? It's pretty funny. Let me erase that. That's my family, by the way, if you haven't seen them before. So they range all the way from 32 years to 32, 26, 24, 22, 8, and 5. Oh my gosh. Somebody asked me, how long are you going to be doing this Medicare thing? And I said a long time because this guy is 5 years old. So to get him through college, let's just say I got at least 22-ish years or more. I'll be on Medicare at that same time, be teaching myself. All right, so let's go ahead and take a look at some of these plans here. So you're going to probably feel what I'm going to say here, or feel from me that I'm going to lean a little bit in terms of the differences between the PPO plans. Okay, but I said that there are 6 plans and 4 companies. The first company we're going to talk about is Aetna. And this is the core PPO that came out in San Diego County last year, and people are on it now. So it is a what? A 0 premium, right? Everybody can see that at the top. It's a 0 premium plan. So just like Alignment is right now, there is no cost to go for this premium plan on a monthly basis, right? And it's a PPO plan that is also a national network. So that's another positive about this Aetna plan is if you were traveling, if you're going to go visit your family somewhere in, Michigan or something like that, and you're going to do an extended stay, you could actually see any Aetna contracted doctor anywhere in the country. So that's definitely a nice thing to have. The alignment plan was regional. So if remember, we saw that like we had like counties, like you could go to Ventura, you can go to LA, right? There were some areas that you could go with the PPO plan last year, but with Aetna, it's a national network. Okay. I'm gonna not write, I'm just gonna kind of use the highlighter to highlight some things. So monthly parent premium is zero. Plan deductible is zero. MOOP, right? Our maximum out of pocket is 4,500, but that is for in-network services. So we're focused on scripts. So if I go to scripts, my max out of pocket could be as high as 8,900. And the reason they're also saying the word combined, it means it's not going to be 4,500 plus 8,900, right? It's a total, whether you see some doctors in network, some doctors out of network, the math, they add them together to give you a grand total of 8,900. And if you should ever reach the max out of pocket, everything is covered at 100%. Okay. Now, none of us want to get there, but it's nice to know, like I said, if I had $100,000 of expenses, I will only pay up to the 8,900. Okay. So here's a question that most of you also want to know. What about the hospital? So there's always been a difference, and I talked a lot about it last year between how Scripps has a hospital contract and Scripps has a doctor contract. It's called something else, but that's the easiest way to explain it. So the good news as well on this plan is that Aetna has an in-network contract with the hospital. So Scripps hospitals are in network. So if you were working with a surgeon and you were going to have like shoulder surgery and you go to a Scripps specialist, the specialist is out of network and that his or her fees could be out of network, but the hospital itself would be in network. Okay. Or if you had an inpatient hospital stay, right? But the cost is a little bit higher, right? We're looking at $350 a day for up to days 1, 2, 3, 4. And this is per stay. If you left the hospital, if you had let's say you had a 7-day hospital stay, your cost would only be the first 4 days. So a total of $1,400. And everything you pay in the plan goes towards that 8,900 max. All right. Now, if you went home in January and you had another hospital stay in June, then this would start over again. Okay. So it's per stay. So this is a per stay type of scenario. Okay. And if you went to an outpatient, not a hospital, but an ambulatory surgical center, another common thing, like I said, the shoulder surgery, that would be a $350 copay. The 4 surgery centers with scripts are also in network. Okay. So that's good news for the Aetna plan. Why would I want to go to another hospital and pay 50%? Right? Especially if you're in a situation where you like scripts. So a good news would be is that the hospital is with scripts um, contract. Now, I will tell you that I did find out that Aetna, for some crazy reason, has an annual renewal with Scripps, annual contract renewal. So, is it possible that they might not have this contract in 2025? It is possible, but I would say it's not probable. Aetna is huge in the under 65 insurance space with employers, commercial plans, we call them, and they have so many contracts, they would lose a lot more business than they did even with Medicare. So they just renegotiate rates basically every year. So we don't expect. Same thing happened to them this year in 2024. As the year started, they didn't have the contract worked out, but they accepted people all year long until the contract was officially renewed. And so people had the Scripps Hospital in network all year long. All right. Okay, let's talk about normal stuff that we do. Well, that's going to a doctor, right? So if I'm going to see a primary care doctor at Scripps, it's out of network, $25, right? So that's my copay. If I do a specialist, see a specialist, it's $65. Okay. Now remember this just so we, kind of recap a little bit. Even on your current plan, you may like Scripps. A lot of us like Scripps. But that doesn't mean that every single doctor that you've seen is inside of Scripps, because those HMO plans we had 2 years ago, there were lots of other contracted doctors who were in the networks that weren't actually Scripps. So you probably remember me talking about any Scripps is the one that has the little logo on the building, right? But some of our biggest dermatologists in North County, are not part of Scripps. Maybe some of them are, but the dermatology like DMG, right, and DSI, dermatology specialists, and dermatology medical group, those are two very, very popular groups that are, right, not in Scripps. So they might actually be in network. So there could be a lot of specialists that you might still see that would cost you a little bit less money. But a Scripps Coastal, a Scripps Clinic doctor would be 25 and 65. Okay. One of the reasons I'm showing you this plan first is because some of the other companies have these as percentages. And so we'll talk about that in a little bit. Preventative, obviously, you want to do your best to see all your preventative care and it's in network. If you did have something more expensive, even a preventative care service could have a charge of up to 50%. So, not so good on that. But if I wanted to get, let's see, the things that are Medicare required, you would, excuse me, go to CVS to get your shot for the flu shot or for Shingrix. You wouldn't go to a Scripps facility. So if you went to Scripps, you're going to have to pay the administration fee. So you want to get that done at, an in-network pharmacy. Okay. Emergency care and urgent care is the same, whether you're in network and out of network, because it is emergency. So they're not going to charge you any different cost. And that's the same with every single plan. All right, what about the other things that we do? Well, diagnostic tests and procedures. That's kind of like an echocardiogram. A little bit more expensive one would be the MRIs and CT scans. So that's diagnostic radiology. So you're saying that's 295. And wow, look at this. If Scripps facility for this is out of network because it's associated with the doctors, in most cases, you're going to pay 50%. Okay, so labs are zero in network and out of network $65. So, what can you do to keep it as a low cost? You have to retrain yourself to say, I'm going to a Scripps doctor, and the doctor wants me to get some lab work done. And so you would traditionally go, okay, I'm just going to go down the hall or down the stairs and I'm going to go to the Scripps lab. Guess what? You have to change your thinking if you want to save money. Instead, you say, go ahead and just give me the order. Go ahead, like a prescription, give me the order to get my lab work. I'm going to take that and I'm going to go to an in-network lab, right? Are you at Scripps because they draw your blood? Lots of people can draw blood, right? So would I rather pay zero than 65? So there's Quest Labs and there's CRL Labs. Those are two of the biggest, labs that are in. And you could just go to one of those lab facilities and walk in and say, here's my order. And you get the lab work done at a lower cost. Same thing with x-rays and diagnostics as well. Mammograms, you just don't want to pay a higher cost by going to a Scripps facility when you could get that exact same MRI done over at, say, Imaging Healthcare Specialists, right? Anybody heard that name? It's a big one. They have a facility in Sanitas. They have another one that is over at Vista Way in Oceanside. Okay. So this is, some of the average costs. Still got a little bit of the extra benefits in here. We got some hearing aids, a free hearing exam, a little bit of dental, not a whole lot, right? You get $1,000 allowance. So you basically have $1,000 bucket of money to spend. Good news on Aetna, they do have a nice, really, really nice PPO network for their dental. Vision, you get a free eye exam and it covers one pair of glasses, but only after cataract surgery. So you really don't get any kind of glasses. You just get a routine eye exam and then you're going to go, somewhere else. And again, you might love your Scripps optometrist, but you know what? Do I want to pay 50% for that exam or just go to an in-network like VSP provider, for my eye exam and pay zero? And I'm not going to go through every single one of these, but you kind of get the idea, right? Um, Here's the thing that I want to bring up to you again. How would I ever, as a patient, ever get to the 8,900? If I'm paying 25 bucks, if I'm paying 65 bucks, even if I have an outpatient surgery and I'm paying 350 bucks, how am I ever going to get to the risk factor of this $8,900? So this is applicable towards any HMO and any PPO plan that's out there. There's three areas, in my opinion, and it's kind of really two. It's treatment for cancer, whether it's radiation cancer, chemotherapy, because those are expensive treatments, right? And so those could be easily $5,000 per treatment. So if I'm going to, and MD Anderson is out of network with this plan, okay, it's not the hospital, it's a specialty care. So you can look at this and don't pass out, but it's 50%. So again, if I go in for a chemotherapy treatment or radiation type of treatment and it's a $5,000 treatment, that means I'm paying 2,500 bucks per treatment, right? That's how you would ever get to your maximum out of pocket, right? In four treatments, you could be at your maximum out of pocket, right? So chemotherapy, or basically Part B type drugs or other Part B drugs that are out there that are more expensive as well. A lot of people get treatments for maybe MS and some other conditions. So that is one of the biggest areas, and it's just a risk, right? It may not have happened to you, excuse me, but it might have happened to somebody that you know, friends or family. So that's one area. The other area I think we've already went over. Sorry, I'm going to go back a lot. The other area is the hospital, right? So the other higher cost of the plan would be a hospitalization. 4 days, $1,400. Okay. And then the third one is skilled nursing. Okay. And this is the one I kind of say, I don't know that it's really that expensive, because most people are not going to stay in a skilled nursing facility if they have any kind of choice in it, right? They're not going to stay in a skilled nursing facility longer than 20 days. So for the first 20 days, the skilled nursing is only $10 a day. So 200 bucks, right? So even if you had a hospitalization and a skilled nursing stay up to 20 days, you're looking at a grand total of what, right? $1,600. You're still a very, very far cry away from the maximum out of pocket, but they still has the risk, right? Because if you ended up with a longer stay, multiple hospital trips, or you stayed longer in a skilled nursing facility, well, the NICS is 203 a day for up to 100 days. So, every 10 days it's $2,000, right? So that can add up very quickly as well. I just think that in most cases, most people are released within the first 20 days from a skilled nursing facility. So that's really it. I'm going to show you a couple of quick pictures of some of the other PPOs as well. Got a question in here from Helen. Hey, Helen, I don't see you, but glad you're on here today, about costs at UCSD. I wasn't going to break down UCSD onto this webinar, but I can touch on it at the end if you'd like to stay. I'm more than happy to go over that as well. So, so based upon this is the same kind of a concept or structure that all PPO plans have. And what we're looking at is, well, this is what it means to stay with Scripps. All right. Who's the next best? Next, well, not the best, but who's another option? All right. And we're going to go through this one quicker because now you understand the structure of everything I just said. And all of them are very similar, right, in the way that they're structured. So United Healthcare absolutely has the hospital contract as well. What's different from this one versus Aetna? It starts out with a minimum monthly plan premium. So you're going to pay $40 a month where the Aetna plan was zero. Okay, so where's the value? What am I getting versus, not getting? So maximum out of pocket in network is 4,900. Okay, but we know Scripps says what? Out of network. So it's higher, right? And that was 8,900. This is 10,100. So your risk is higher, but they do have the hospital. So that's good news. And their contract, I've been told, is multiple year. So 350 a day, but guess what? 7 days. So Aetna's was 4 days. United Healthcare is an extra 3 days. Ambulatory, again, 300. Aetna was 350. And now their out-of-network costs for these things are a little bit less. You're going to see the pattern where Aetna was 50% everywhere. United Healthcare is 40% on the other things that are out of network. So again, when we were looking at labs, we were looking at things like that. Well, we'll talk about in a sec. Primary care doctor, Scripps, out of network, $40, right? Specialists, 65. So Aetna was a little bit less expensive because their primary was 25, specialist was 65, so that's the same. All right. Then we can come down here. Emergency care, like I said, is the same. Let me see where those labs were. Sorry, I want to take a look at that. Here it is at the bottom. So again, consistency, Aetna was more on the 50% side if you chose to go out of network, where you see 40, right? 40, 40 for all these things. Again, labs are 0. X-rays are less than what Aetna was. Therapeutic radiology, that's a fixed fee. Diagnostic, right? So these are figures that are slightly less than what it was on the Aetna plan for these things, again, in network, by you making that choice to take your lab slip to somewhere else to go to get that lab work done. All right. I'm not going to go through every single one of these, like I said, because we could be here all night and we're not going to do that to you. Has a little bit of dental, 750. They do have the free eye exam, and this one does give you $300 for your glasses or frames. Mental health, which everybody has, but I need more of right now, mental health treatment. And then, and of course, they all have, prescription drug coverage as well. So they're all going to have prescription drug coverage. Now, I'm not going to focus on this a lot. Did I hit that? I'm not going to focus a lot on this because that's not the focus of this call today, but you heard a lot of things in the news. I sent you out some information a couple of weeks ago about the Inflation Reduction Act and the new maximum $2,000 out of pocket, right? So $2,000 out of pocket. What we didn't see in almost any HMO or PPO plan before this year was a deductible for drugs in a Medicare Advantage plan. But this year, we're seeing a lot of companies having a deductible in their PPO plans and their HMO plans. So it's just something to be aware of. Again, it's only typically for people who are on tier 3, 4, and 5, tier drugs, which are typically the brand names. If you're in the tier 1 and 2, then you don't have to pay that deductible. And so that's the same with most of the companies out there today as well. All right. This one has the fitness membership. Aetna has silver sneakers. United Healthcare has their own branded one. One other benefit with this one is they have an OTC. So you can get $40 a quarter for your vitamins, right? Things like that. Aetna doesn't have it included in theirs. So do you want me to go through all 6 plans? Yeah. See, I didn't think so. All right. I'm showing you what I think are to be the top 2 in my estimation of the plans that have some of the lowest costs, the lowest copays, and, the lowest maximum as out of pocket. I would be remiss if I didn't actually, though, show you a little bit of one that is a company that we're all familiar with called Alignment. Okay. So we know that the Alignment PPO you're on now went out, but they did come out with a new plan called the Freedom Plan. All right. So we have a Freedom PPO. Yay. Okay. Why am I not shouting it from the rooftops to everyone that this should be the plan for you? Okay. I'm just going to go through a couple quick. Ready? It's $23.10 a month. Sorry. Has no deductible. Max out of pocket. Oh my gosh. The in-network is 78. Remember when I said about 12,000? All right, I added $50. 11,950. So the alignment plan has got a almost $12,000 maximum out of pocket. That's the highest risk, right? Versus Aetna's 8,900. It's almost $3,000 more out of your pocket in a worst case scenario. Hospitalization, you pay $1,632. One night or up to 60 nights, you pay $1,632. That actually matches what original Medicare is. And then you see a theme of 20%, right? So the 20% you would say, okay, well, that's not too bad because 20% of maybe a primary care doctor visit is like, $100 in San Diego. So you're only paying 20. If I see a specialist, okay, let's say it's $300 or $400, $400, okay, you're paying 80. That's fine. So maybe you're competitive with the other plans, but I'm sorry, I just personally can't get away from this, and that's me. And so as much as I like Alignment as a company, as what they've done, I just don't think that this is going to be a great option for all of you. But you can, obviously, this is where you get to make those choices, right? All right. The other thing I'm going to show you is something that everybody has to promise to not turn me in. Okay. Do you all promise to not turn me in? I want to see some nods. Okay, thank you. All right. So what is this? This is Paul's, not any company sponsored worksheet. This is Paul's Excel spreadsheet that is a straight up comparison of all 6 plans that are available in San Diego with PPOs with access to scripts. Stop it. I see what you're doing. You've been watching something the whole time and now you're scooching over on the couch. All right. Oh, look, he's taking his camera out too. All right. So here's the deal. If you want to talk about this, I can easily show you what the differences are between Aetna's core PPO. They have another core PPO 2. You have United Health here. We just took a snapshot of Blue Shield PPO. Reason I don't like Blue Shield personally is they have a monthly premium of 41 and they have a $750 deductible for out of network, which is Scripps is. So the minute you walk into a Blue Shield plan, we're at $480 for a year and we're at $750 for out of network deductible. I'm already at $1,350, right? So in my opinion, it's one of the most expensive options as well. And the risk factor is still 8,950. Aetna Alignment has another plan, but again, 8,950, but it's not good on some of the other things, and then the Freedom plan here. So I've done the research, right? I have the information to show you what your plan options are. It's not up to me to make that decision for you. What you have to decide is what is going to be best for you and for your family, right? I'm not here to say you should go to a Medicare supplement and pay $2,600 or more, depending upon your age. But if you want to have the most guaranteed way to get to scripts, I can tell you that's what it is. Or if you're willing to take a little bit of a risk, and I don't mean that in a weird way. We're not gambling here, but there are many, many times that we look back on our life and say, man, for the last 10 years, I've never been hospitalized. I've never had a cancer treatment, right? I've never been in one of those skilled nursing facilities, nor do I want to go there. And maybe a PPO plan is going to cost you a couple $100. So you could look at that as saving $2,400. But we all know that if the risk happens, if the situation happens where that, treatment is necessary, well, that's what we could possibly face. All right. Somebody asked me about Helen asked me about the Humana plans. They have 2 plans that you can get to. Neither one of these plans, ready? Neither one of these plans will get you 2 scripts. Okay. So just cancel scripts out of it. But it's a really good plan. Humana has a good relationship with UCSD. And so this plan is pretty good. They have a 0 premium plan, but I'm showing you the $18 plan because it's got a little bit lower of the benefits, lower costs, I mean. And so for $18, I feel like we all can kind of throw down $18 and then lower our maximum out of pockets. No deductible, no pharmacy deductible at all. I just told you that a lot of companies were adding the pharmacy deductible, right? This one has no pharmacy deductible, and you're at $38.50 in network. So if the majority of the UCSD doctors are in network in this plan, you really are truly looking at 3,850 because you don't need to go out of network. All right. Scripps will not take this Humana plan. Hospitalization in network, 225 a day versus the 350, days 1 through 5. Okay. Doctor visits, primary care are 0, specialists are 15. Wow, right? Pretty nice. Outpatient surgery center, $100. So it's a pretty good plan in terms of what they're offering. You're going to see that obviously the facilities fees, right? Radiology, right? $150 for that. Labs, x-rays are 0. Mammograms are 0. That's normal. Labs are 0, right? So a lot of these things are lower. But again, the thing that you're going to do by going to a plan like this is what? You're leaving scripts, right? And for the right person, right, that might be the right option for you. Also, take a look at this. It's kind of nice. That's a $3,000 bucket of money for dental. So they give you some nice dental inside of there. They also are going to give you free vision exam, and they give you 200 or 250 at a plus provider. And it's got the Silver Sneakers gym membership, you know, so this, in my opinion, is a really good plan. But like I said, it wasn't the focus of today's meeting because today's focus was to talk about scripts. All right. I know I can talk a lot. probably too much, as my wife says. We're a little bit at the hour mark, so I'm going to go ahead and open it up to questions. There's not any more questions that I'm seeing on the chat right now. Um, but just to recap a couple questions for like Helen, obviously we can meet in person. Excuse me one sec. Obviously we can meet in person, we can set an appointment, we can do a Zoom, we can figure out what's going to be the best situation for you. And of course, I would like to be the person helping you through this transition if I can.
It's on, and you have to take this off. It's off.
All right. So I hear you, Bing and Juliana. I hear y'all. I didn't say I'd unmuted everybody yet, but hey, you jumped ahead of me. That's all right. I love it. So I'm going to open it up. And if there's any questions, I'm going to take everybody off.
I have a question.
Yes, ma'am. Go ahead.
Okay.
Oh, I can't hear you. Sorry, go ahead. Hit it again.
You did that on purpose, right? Okay, Paul. Okay. When you mentioned about PPOs with scripts, right? That scripts will only accept PPOs.
Yep.
And then the alternative is the supplemental, right? That scripts will take. Now, when you say will it be accepted at all of scripts, facilities, and doctors, or are there again limited facilities, or I
don't. Because it is a PPO plan, there is always the opportunity for a doctor or an organization to say, we won't take that PPO. Scripps has made the determination that they won't take Humana. So if you go to a doctor that doesn't take the PPO plan, you can pay whatever the costs are that they're asking you to pay. If they say, hey, you're going to see a primary care physician, we want $300. You could pay that $300. You could go back to Humana and say, I want you to reimburse me $265 because I went to an out-of-network, right, doctor, and your copay for that was this. So you could do that with any basically organization. It's just that the organization is not going to make it easy on you. Okay. So that's why I'm saying you don't go to Scripps with Humana. And all I can tell you is Scripps is still being a little bit vague, but I can tell you that they are still continuing to take Aetna, United Healthcare, Blue Shield, and Alignment now, right? And so if they're taking them as out of network now, we don't see them making any statements. They have not changed statements. They have not published any statements stating that they won't take the PPO out of network next year. Alignment was trying to be really safe with their words in July by stating, go call your doctor and ask them if you're going to take alignment in 2025. It was stinking July. Nobody wanted to talk about 2025. And do you think your personal doctor knew? They don't know, right? They don't know. So this might be the time that you could make that call, Juliana. And I'm telling you that they're taking the plan now, but do I know? Will they take it in 2025? They're telling us they are, but the proof is only going to be when you talk to Scripps yourself. And so I would say if this was your choice, you're going to want to make a phone call to your doctor at this point. Now they should be expecting it, right? It's annual election period. Medicare AEP is here. They're going to need to start answering these questions. So just like a year ago when they were waffling, they got better as the season went on into answering the questions. But if you called them and said, hey, will you take a PPO plan? I know that I'm out of network, but will you take my PPO plan? And what have we been told is they'll say yes.
right, but okay, I get that. But let's just say I choose a PPO plan that they will accept. I guess I'm trying to make sure that all of Scripps is open to accepting that plan. Because remember when for 2024, if you did not sign up with Alignment, I think before 2024, then I know people were limited to certain facilities. So I just want to make sure
They weren't limited.
2020.
No, that's not actually true. Sorry.
Okay,
They weren't ever limited to facilities. It was a difference of being in network or out of network. So there are a lot of like, there was only 1,800 of you. Okay. I think most of you on this call, there was only 1,800 of you who were in this legacy, they called it, legacy
right.
group that were given the permission to stay in network. There's another couple thousand or more that joined the alignment PPO, and all of them are facing what it was this year. They're all out of network. So it wasn't about limitation of the facilities ever. It was about the costs. Are you in network or out of network? So there was 1,800 of you that were in network.
Oh, okay. So that eliminates that discrepancy because it's going to be all out of network.
Correct.
Yes.
Right.
Okay. And then same thing with supplemental, you know, like you said, that'll open up the outside of scripts also.
Right.
Now, UCSD, just curious, because I don't know too much about UCSD. I just know that they're kind of south, mainly south, like La Jolla areas. Um, and I think they were thinking of
So
coming
let
up
me answer
north.
that before you go too far.
Yeah, go ahead. Go ahead.
UCSD has been developing new offices in closer. So Encinitas has been built out. So they have an Encinitas urgent care right next to the Trader Joe's parking lot.
Mm-hmm.
On Encinitas Boulevard in El Camino. There's another
Mm-hmm.
also facility there in that area. I forget what it's called off the top of my head. It's a very popular street with other medical groups and medical offices, but
El Camino,
right there. No, but that's
El
okay.
Camino Real, maybe.
But it's in that area, same kind of basic area. And then they also have an office in Sycamore, in Vista. So Sycamore Drive, right off of the 78. So they have a big office
Right.
there. They have specialists, I mean, doctors and specialists. They do oncology treatments there. And then you have Rancho Bernardo as well. So they are growing their presence in North County, but their in network hospital, the closest is where? La Jolla, right?
Right.
And the thing fell through with Tri City. So if y'all didn't see
Right.
that in the news earlier
Yes,
in the
I saw
year, they somehow didn't come to an agreement. And so UCSD broke off the agreement to take over the management of Tri City. So that's not going to be happening. So you're right. There's going to be a little bit more of the specialty care, hospitalization, surgical procedures are going to be there. Um, but yeah, those are the choices you have to consider.
and just hope that maybe they'll expand into North County more.
Yeah, and I think that they have a big push, not just for the reason of script. I mean, not just because of this situation that we're all in, but for the situation that happened a year ago. So I will tell you, as I mentioned to you earlier, scan was a great option. And some of you, met me and said, I hate scan. Scan's horrible now. It wasn't Scan's decision a year ago, right? It was
Right.
Scripps' decision. And so Scan just got the brunt of it because they had the majority of Scripps HMO patients. And so a lot of them went to UCSD. Well, UCSD has now closed their panels to all doctors through Scan. And so if you can't get to a new primary care doctor at UCSD, then you're not going to be able to get to that plan, right? And that's because of the volume that they took on last year. And so if I have to book with a doctor using an HMO model, it might take them a longer period of time potentially to get there. But the UCSC specialists, right? There's a lot more of those. And with original Medicare, right, you still have that total freedom. So they definitely at UCSD are taking the original Medicare, right? They're taking the network with specialists through a couple different plans. So there are ways to get there through an HMO. You could still go to scan. And you've heard me talk about the Perlman clinics before. They are growing like crazy. They have 28 Perlman clinics throughout San Diego. You could choose a Perlman clinic primary care doctor and choose the UCSD Specialist Network. So that's a great option for a lot of people. And the maximum out of pocket for scan is 500 bucks for the year. That's your worst case scenario. So if you told me that I was sick and had cancer treatment and needed to get care, I could go to the UCSD Moores Cancer Treatment Center and never pay more than 500 bucks for the whole year. but it's an
But
HMO. It's an HMO.
that's an HMO. Okay,
All right,
thank
I'm
you.
going to share. No problem, Julian. I'm going to share it with other people. Any other questions, please? You have to unmute yourself. I unmuted you, so you should be
Okay.
able to unmute, I think. So you should be able to unmute yourself. Couple other questions. Adele, I think she had to leave, so see you next week. Okay. Anybody else? Linda, anybody there? She's
Under
like,
the
nope.
under the Aetna PPO plan are UCSD and what's the other local one? In network?
Hold on. I have looked at a handful of doctors in the Aetna PPO that were with UCSD, and I did not find them. So I've had clients who say, well, maybe I could consider that. I might go to Scripps for some, might go to UCSD. There doesn't seem to be a great option for that. United Healthcare doesn't have a contract, hasn't had a contract with UCSD ever. Blue Shield got into a contract dispute a year ago, so they kicked them out as well. So really, if you want to go to UCSD and a PPO plan, it would be the Humana PPO. Now, again, there might be specific doctors. If you had a specific doctor that would be named and they were in that plan at UCSD, it's possible. It's just I can't say as a broad scope that all of them are there. So that might mean you could see them as out of network.
Okay, and the other major medical group that's in Encinitas is maybe you know the
We talk
name on.
about, well, there's Mercy. There's also Scripps Physicians Medical Group, which is physicians. It's not Scripps Coastal, not Scripps Clinic, but there's Scripps Physicians Medical Group. Okay. Gotta love this. What do you call it? Consolidation in the healthcare space. Optum, which is owned by United Healthcare, just bought Scripps Physicians Medical Group last year. So it's really Optum now in that network. Mercy Physicians is a little bit farther. Health Excel, maybe? You could be thinking Health Excel.
I wasn't, but I think what it comes down to is just looking up specific doctors, to your point earlier.
Yeah. So I mean, there's a lot of doctors that are available in other networks and doing some searches. It's not that I get any kickback from the Perlman Clinic. I just believe in their model. I believe that they do a
Actually,
great job.
I was thinking of Perlman. So Perlman is contracted with Aetna, right?
Okay, sorry. Okay, let's say it this way then. Perlman is really like a super doctor because they have 280 doctors on staff at 28 locations, and they have a small medical group that they started. But I think of them primarily as the primary care doctor, and then you choose the medical group to associate with them. So yes, you could choose Perlman Clinic as your primary care doctor, and they have all these doctors around, but you have access to UCSD through them, Scripps Physicians, Health Excel, Optum, right? So you have multiple ways to go in that. No scripts, but multiple ways on others.
Okay, thanks.
You got it. Good to hear your voice, Dan. All right. I know we're about an hour 15. So any other questions? There's nothing in the chat, but any
Wait a
other
minute.
question? Oh, you're coming back?
Well, if nobody else has any questions, no, the last thing you said is kind of confusing me. The Perlman, I'm not familiar with that. But then you said something about you have access to UCSD and Scripps physicians, and then oh, hello?
Sorry, I muted myself. Scripps Physicians Medical Group is another medical group that is utilizing the Scripps name, but it is not Scripps Coastal or Scripps Clinic. They have been around for many, many, many years. I don't know how long ago. They used to be called San Diego Physicians. They got somehow merged and changed their name into being an affiliated group with Scripps. So it's called Scripps Physicians Medical Group. But then they just got bought by, I said, Optum. So again, it's just another group of physicians that are, I don't want to say, decent reputation in San Diego. Perlman
Okay,
Clinic.
so then, okay, right,
Sorry,
but Perlman Clinic, you said UCSD, Scripps Physician Medical Group, and what's the others? Or there's a whole bunch?
there's a whole bunch. I'm not going to list it. Yeah, we
Oh,
just have
okay,
to talk
okay.
through. They contract with like 10 or 12 different medical groups throughout San Diego. So what's kind of cool about, I mean, they've been growing. So I'll tell the quick story and then I'm going to let everybody go and we can schedule some one-on-ones and things like that. But Perlman Clinic was started by Monica Perlman. Monica Perlman was the head of Scripps Clinic primary care doctors. So she was a primary care doctor at Scripps Clinic, and she was the overseer of all of the primary care doctors. As we all probably know and have experienced, I feel like sometimes, we're on the rat race, we're like hamster wheel, whatever. You get in and get them out, right? Get them in, get them out. We're not spending as much time with doctors. And so Dr. Monica Perlman said, I don't like this. She said, they pulled her in and said, you're not seeing enough patients. And she's going, well, I'm taking enough time with the patients I have to make sure we're addressing their concerns. And they said, well, you need to see more. So she quit and she founded her own Perlman Clinic, the first one being in La Jolla. Since then, like I said, they've grown to over 28 locations in San Diego. And as you can see from this, little whatever shots here, they've also expanded into some specialty as well. So primary care is located at all 28. Most of them will also operate as an urgent care. So rather than going up to, excuse me, the Concentra Urgent Care by Home Depot, who made my daughter cry when they went in there and treated her so poorly, up in North County in the 78, the Home Depot and the Concentra I'm talking about. And I don't know why, she had a horrible experience in a serious situation like this, you could actually not have a scheduled appointment with your doctor or Perlman, but they'll fit you in like an urgent care would. So they would make sure you can go to any one of their clinics. And you don't have to pick a primary doctor at one location. You could see any one of the 280 doctors. So in North County, they have one in Vista, one in San Marcos, two in Carlsbad, one in Encinitas. I'm sorry, two in Encinitas, and then two in Del Mar, Solana Beach. And so those are kind of the North County ones, Rancho Bernardo as well. But you could go to any one of their doctors at any one of those locations. Of course, most of us want to develop a relationship with the primary, and you can do that, right? And you'll schedule that meeting out. But if that urgent care need comes up, right, you can go. Hopefully, none of us have to worry about pediatrics. They know that mental health has been a challenge over the last few years. It's been really hard to get to the mental health counselors. So they brought in an internal Zoom team and they have 40 mental health counselors that are on their staff. They have some specialty in wellness, weight management. Dermatology was also another big need. If you had to go to a dermatologist, some of those plans were like, okay, yeah, we'll see you in 6 months. So instead of like referring out, they brought in and they now have their own dermatology team. You still have access to whatever medical group it was, but you could also choose to go to an in-house dermatologist. And then the most recent one that they added was the sports medicine endocrinology. So they have some specialty care, but they've been a primary care group of doctors. Here's what I really like about it. Ready? I want to schedule an appointment. I'm going to do primary care. I'm going to go in office. I'm an adult. Let's just say I'm not a new patient. Well, let's say, well, we'll take it. And I want to establish care with a doctor. Okay. It's going to tell me in a matter of a couple clicks. Does anybody know when Friday, October 11th is?
Tomorrow.
Oh, that's tomorrow. So let's see. Here we are today. I could book with a doctor tomorrow. Now, some of these you're going to see, they have a good team of physician's assistants as well as right? Nurse practitioners, but this is also a doctor. And actually, I know several people who see Dr. Siddiqui. She's great. Now she's down in Bonita, so that's not it. But I'm just showing you the access to immediate care. If you wanted to get to a doctor, it's that easy to get to a doctor, right? Del Mar, that's not too far of a drive. And a DO is a doctor of osteopathy, right? So I have had several people. Now, not everybody is happy, right, with any typical medical group, but you have that option. Also, women's health, men's health, acupuncture, You have some also treatments. They've got some doctors that have some specific areas, integrative health. I have a lady who was on several different medications and she just was having a hard time. She couldn't get through it. She ended up going to, I want to see their map. I can't find their map, but um, she ended up going to this doctor in Del Mar. He stripped her of most of her medications, and within 2 weeks, her migraines were gone. She had been struggling with it for years. And I'm not saying that's going to happen to anybody or everybody, right? But it was her experience that she had. And, she will now never leave them because she was able to, find somebody who took the time to listen, took a more natural approach, and as a result, she's now migraine free. But I wanted to show you this picture because this is the map of all their locations, right? And I told them I was on a couple of webinars yesterday and today with, you know, um, she's got two twin boys, Monica Perlman. So one of them is the president, one of them is the like marketing. So it's pretty cool. They both went to college and came out with degrees, and now they're working in the family business. Really, really good, solid people. I got them on speed dial. So I told them, you know what I need? I need Oceanside. That's what I told them. I said, I need a little bit. Carlsbad, like I said, is this is Bressie Ranch. This one is the Forum Shops, and this is the Encinitas. And so, like I said, they're in the area as an option for you. So
Have they been just recently expanding, or they've expanded into all these areas over the
no,
past?
it's not been overnight. I mean, it's been a period of time, over the last 8 years, I would say they really started their expansion model. When I started working them probably with about, 8-ish years ago, I think they had maybe 5 or 6. So, they've really been expanding. And what they do in some ways, you might think, oh my gosh, how are they getting their doctors? They might be buying a practice of a retiring doctor. So there was a doctor that had an office in Solana Beach, and he was ready to retire. So they went ahead and they bought his practice, and that doctor might continue to work there for several months or a year or so, and they establish, and that's how they develop it. So,
So
all right,
are they in network for a PPO,
for many of them, yeah.
Aetna specifically?
Yes.
Okay. Thanks.
All right.
Oh, wait a minute. Oh,
Let's go with the last question.
well, I'm sorry. I'm just asking. Can you hear me, Paul?
I can hear you.
Oh, the last person who asked you the question, I want to understand that. Can you clarify what is it? Their PPO, HMO, what is it?
He just said, can you reach Perlman Clinic with a PPO plan? And I said, yes, they're in network with the PPO. And he specifically said Aetna. So
Oh, okay.
he just was asking. So, like, let's just say maybe the question was going towards I might go to Scripps for some specialists that I have, but I might go to Perlman Clinic as a primary. So having that option. All right. By the way, this was today's webinar just to kind of show you an idea. Again, they're going to show you the hospitals up here, but this is some of the plans that they have. So what they're saying is what's available for you with the individual insurance companies. So Aetna available with the Perlman Clinic, right? All of these services, and then their hospitalization network would be with Scripps because they do have, like I've told you last year, Health Excel gets you to Scripps. The Optum Care can get you to Scripps. Then we have UCSD is available with Humana, right? Aetna is available here. Regal is another medical group with Scan, right? United Healthcare can get you to Sharp. Health Excel can get you to Scripps, right? Mercy with Scripps, that's being the hospitals, right? This is the hospital. So again, they've got a lot of different contracts with the insurance companies to allow you to do that. They're in with the Humana PPO, they're in with the Aetna PPO, they're in with the United Healthcare PPO. So the answer is basically yes to that question. So listen, I know that we could talk probably for a long time about audio sensitive. We started off this meeting with about 20 people. We're down to 8. And I'm going to record this one and put it up. So Linda, bye. Thank you so much for being on this call though today. What I encourage you to do is set a one-on-one appointment. We can, do that potentially in person next week, or in November. We'll also be able to schedule Zoom meetings at any time between now and then as well. And listen, Medicare hasn't started. It doesn't start till October 15th. So we still have time. And what I want you all to know is I got your back. All right. So I'm here to help.
Cool, thank you.
Thank you.
All right. You're welcome, everyone. Thank you for being on here tonight. Have a
Get
great
rest.
evening. Bye bye.